So let's kick off. So yeah, I mean, first of all, thanks everyone for joining the webinar today. Really excited about the topic and the speakers that we've got on today. Just by way of introduction, for anyone who doesn't know me, so my name's Tiernan. I'm the CEO and one of the co-founders at Hello Lamppost. And today is really about celebrating innovation success within the public sector. I'm really talking about how organizations are using technology to revolutionize digital healthcare and wellbeing services. So it's really a celebration of Stephen and Joe's work at their respective organizations. A little bit of housekeeping. So everyone as standard should be muted, but if not, for some reason, if there's some technical glitch, please just pop yourself on mute. That'd be great. We have left time for questions at the end, but there should be a chat function. If you want to drop in questions throughout the talks, feel free to do so, and I'll pick them up at the end in the kind of allocated slot that we've got. And we are recording the session, as I mentioned before, and we'll send it out in a follow-up afterwards, just in case anyone misses it. I won't dwell on me. I introduce myself. The more important people are Stephen Penman, who is the Head of Strategic Communication at North Lanarkshire Council. I'll let him do a proper introduction, but a little summary is that he's responsible for campaigns, media relations, digital media, community partnerships, and internal comms. And he's a member of the corporate management team at North Lanarkshire, which is Scotland's fourth largest local authority, serving 350,000 residents. So really looking forward to hearing from him. We do have one apology, but we do have a trick up our sleeve with a recording from her. But Jo Miller is from NHS Royal United Hospitals Bath. She was due to be joining us today, but she had back surgery pulled forward, sod's law, by a couple of days, which overlapped with this. So she sadly can't make it today, but like I said, we have a recording of her, which we'll play, but a little brief introduction on her behalf. So she's the Chief Nursing Information Officer at NHS RUH Bath. And throughout her career, she's been involved in a huge variety of public health departments and projects, including patient safety, transformation, acute and primary care. And even though she can't be here today, she did leave a little note that she has pre-recorded her presentation and she sends her profuse apologies. But as everyone will understand, it's with good reason. But she's done a fantastic video. She gives a good summary. So now is a good time to hand over firstly to our panelists, and firstly Stephen. And as I say, throughout the talks, please feel free to pop in the questions in the chat and I'll pick them up at the end. So over to you, Stephen.
Great, thanks, Tiernan. Hi, everyone. So, yeah, my name's Stephen Penman, and although I work for North Lanarkshire Council, I'm responsible for the Suicide Prevention North Lanarkshire campaigns. Suicide Prevention North Lanarkshire is a partnership between the Council, NHS Lanarkshire and Police Scotland. Can we move on to the next slide, Tiernan? Thanks. I should say at the outset of this that for the next few minutes, I'm going to be talking openly about suicide, about low mood and mental well-being. And anybody in the call, you should know that if you're feeling low or having thoughts of suicide, that there are people you can talk to, or you can call Samaritans on 116 123 from any phone. The single most important thing about suicidal thoughts is that you talk about them. So please, if you're feeling that way, please do seek some help. Thanks, Tia. Next slide. So just a bit of sort of context to our campaign and the reasons we do a campaign about suicide prevention. So since 2017, suicide rates in North Lanarkshire vary between 40 a year to around 60. And as you'd expect, the highest number in recent years was during the first part of the pandemic. And it's reasonable to say that lockdown and isolation were drivers of that sort of slightly increased number. So this year, until the end of November, there have been 35 suicides or deaths by probable suicide to date. And while this looks like it will be an improvement overall this year, it's still too many. Next slide, please. So I think in designing any campaign, we need to understand as much as possible about the audience, and having as complete a picture as possible is really important to that. I'll come on to why that's quite difficult for this topic shortly, but we do know we have two main at-risk groups in North Lanarkshire. Young people aged between 14 and 25, particularly in the towns of Motherwell and Wishaw, which are next to each other in the south part of North Lanarkshire. And there's a wider grouping of men aged between 34 and 54. And this group are 3 times more likely to complete suicide than women. And at its heart, I suppose the strategy is about building communities committed to talking openly and freely about suicide, promoting wellness and mental health, and supporting those bereaved by suicide. Next slide, please. And there are some key issues, I suppose, to tackle. Stigma is probably the hardest one to tackle. There is still a stigma about talking about suicide at all. But when I started in local government in 2009, the idea that we would be having this conversation even would be pretty unheard of. The idea that somebody like me would come into virtual rooms like this, or real rooms like the one I was in last week talking about suicide prevention, would be almost unimaginable. Men in particular are less likely to seek help. And one of the things that's hardest to talk about is the massive impact suicide has on family, friends, and the wider community. It's really important that advice is practical, that it's in plain language, and that it's supportive. And the plain language bit's really important. There are an awful lot of euphemisms used about suicide, but you know, we call it what it is, suicide, and that's quite a difficult first hurdle to get over. And we talk a lot about, I suppose, locations of concern, and these are places where a disproportionate number of suicides happen. And I'll come back to that point in a second. Next slide, please. So every good campaign needs clear objectives, and these are really ours. So what we're trying to do is improve community understanding and capacity to deal with suicide through a collaborative approach with partners. And that collaborative approach is with businesses, with public agencies, with individuals. One of our sort of biggest partnerships is with Motherwell Football Club, who are a Scottish Premier League club, who have had past players who have completed suicide. And, you know, these partnerships, particularly when it relates to that audience about men, is really, really important. So we do a lot of work with football clubs. We do a lot of work with youth groups. We do a lot of work through our own staff to try and, you know, have this conversation and talk about suicide. We need to educate and support people, parents, families, teachers, community members, about spotting signs of suicidal thoughts and how to offer that support. And we do sort of suicide awareness training, which we run with free sessions for people who are in that position, who can perhaps help have those conversations. It's really important, obviously, that we signpost people to appropriate support, and much of our campaigning is based around that. And getting people to talk about suicide is the biggest issue of all. Next slide, please. So a couple of just brief creative sort of concepts from previous campaigns. The one on the left was really targeted at young men in particular, mostly through paid for social media. And we were able to specify times, for example, within those campaigns when the content would be served to this audience, mostly at night, often at weekends. And we worked with Samaritans and Breathing Space to work out when the best times, and, you know, based on their call volumes, when the best times to target that particular age group was. And the one on the right really is part of the wider campaign about the stigma around suicide. So the fact is that anyone can experience suicidal thoughts, and we're trying to sort of butt against some of the cliches about who is most at risk. When I started talking professionally about suicide, you know, a decade or more ago, it was pretty straightforward in our part of the country. People who were most at risk of suicide had probably some experience in the prison system, had probably had addiction issues, or both. But that picture's changed quite dramatically over that decade and more, where the people who are going to experience suicidal thoughts, that audience is much, much wider than it ever was before. Next slide, please. So locations of concern, you know, in the last 2 or 3 years, it's become clear that we've had some locations of concern. So what is this gives rise to something called cluster concern. And, you know, that you can see the definition at the top of the slide there. Cluster concern is when more suicides within a time period within a specific location or same time periods or similar methods at the same location are present, or where single suicides in groups vulnerable to imitation are present. So that tends to be younger people. And locations of concern are really important when it comes to directly intervening around this issue. I should point out that clusters are really rare, and we would never, in any PR material or anything like that, refer to them as clusters. They're the ones you most often read about in the media, but they are really distressing for family, friends, and for communities in a wider sense. So locations of concern are pretty significant from our point of view. Our biggest concern in terms of dealing with clusters is how the partners and others can intervene in a positive way to try and break that pattern, I suppose, in terms of clusters. Next slide, please. So we never identify these locations as part of a campaign, but there are 3 key areas of concern in North Lanarkshire right now. And our first focus, and it's long been a location of concern, is Strathclyde Country Park in Motherwell, which is the arrow at the bottom of the map there. And we've fairly recently added 2 others, Centenary Park in Airdrie and Drumpellier Country Park in Coatbridge. So we've identified that through over that kind of 5-year period that I defined earlier on. We've identified these as locations of concern. So the big question is, what can we do to intervene at those locations in a really targeted, positive way? Next slide, please. So we came up with Feel Well NL, NL being North Lanarkshire, and we worked really closely with Hello Lamppost on this. The question for me with the team was, could Hello Lamppost technology be used to help people who reported low mood or suicidal thoughts in places perhaps where human intervention isn't always possible or timely? Next slide, please. So our overall purpose wasn't just to talk to people experiencing low mood or suicidal thoughts. We wanted the experience to be interactive and allow people to make choices about how they interacted. So people who scan the QR code or SMS are asked how they're feeling today at its base level. If people say they're feeling good or excellent, then we signpost them. The service automatically signposts them to information on local attractions close to the location. You know, is there a museum or a leisure centre close by that people might want to visit in the case of the parks? Is there a walking trail and people might want to go for a walk on? And that's a kind of graded thing. So that's for people who say they're feeling good. For people who say they're feeling bad, they're sent down another conversation route altogether. And that's one where we aim to get them to the right support really, really quickly. Next slide, please. So this is for our first site at Strathclyde Park. It's been going for just about a year. We've had 97 users with 200 taking part in 200 conversations with the service. Higher interactions have been sort of the start of spring, which May, and we've still got some work to do on this, coincide with the start of the school holidays at the end of May. Airdrie was our next service, and we had a bad route interaction in the first 24 hours of the service being in place. In other words, within 24 hours of that service being in place, somebody reported that we're feeling suicidal in response to the question asked when they scanned the QR code. So you can see in the table at the bottom the number of users, the number of conversations that have been had, and the number of messages that have been exchanged in those 3 sites. Next slide, please. So although the numbers look low, it's really important to consider that a third of users have said they're feeling bad. And I'll come on to you will be able to read unless you've got exceptional eyesight, the interaction on the right. I'll come on to that in a second. But the people who say that they're feeling bad are signposted to information that potentially saves their life. So if we talk about 22 people, that's 22 interactions, which could mean 22 fewer suicides. And in the context of 40 to 60 a year, that's a very, very significant number. So just in terms of the detail of the interaction on the right of the slide, the person's messaged, they're asked how they feel, and they clearly don't feel great. The users told the service they feel or have felt suicidal in response to a question, an automated question, and immediately they're signposted to the right information in a very, very open way. So if you have a plan that you think you might be tempted to carry out today, please call the emergency services 999 straight away and ask for help. If you don't want to do this or don't think you will try to take your life today, please call a helpline where you can speak to someone who's experienced in managing feelings of suicide and will help keep you safe. And then it signposts automatically to Samaritans, to NHS 24. If you're under 18, it signposts you to Childline. So really clear and obvious and straightforward advice to people, which, as I say, for 22 people in the last year, that's potentially saved their life. Next slide, please. So this is the plate, if you like, that's on the assets, and whether that be the photos you saw was a bench earlier on. It's in the places we need it to be. It's in the places we've identified that are potential locations of concern for us. I think it's important at this stage to say we're really only in the foothills of what automated interaction can do in terms of suicide prevention and awareness. We're continually looking for ways to improve that. And we're talking with Hello Lamppost about ways in which we can develop that service further. I think there's no doubt at all that automated response that's still in a very human tone of voice is potentially hugely impactful in terms of preventing suicide in North Lanarkshire. I think that, as I say, 22 people doesn't sound like a lot of people in the context of 350,000 residents, but that's potentially 22 lives saved. And I think that alone probably is probably the most telling statistic. There's no doubt at all that this is a huge and important part of the partnerships campaigns. As I said, I think this has got real potential for growth for us, and I really expect it to become more important. And that was a very brief whistle-stop tour of Feel Well NL. Thanks for your time, and I'd be happy to answer any questions you might have.
Brilliant. Yeah, thanks very much, Stephen. Yeah, as Stephen just mentioned, if you do have any questions, pop them in the chat for those who have joined me. There's a chat function, and we should have some time at the end. Yeah, really great summary, I think, Stephen. And I've always been fascinated by your team's work around the subject matter, and we've been really had our eyes open from the use of our technology, I think, and to your point about it's, where we work in such a huge variety of contexts, actually, for this deployment, it's less about, reaching vast amount of residents, and it's more about targeting those areas and those people who are in need at a specific point in time where it's not possible for council staff or otherwise to be there 24/7 in those places to give people assistance. So definitely been super interesting for us, and like you said, yeah, really exciting by those next steps that I think we're going to take with some of those developments. I'm not going to ramble on too long. I know we're running slightly behind on time, so apologies for that. Yeah, thanks for the first question. Keep them coming in. I'll get to those at the end. For those who joined slightly late, so our second panelist, Jo Miller, who's the Chief Nursing Information Officer at Royal United Hospitals Bath, unfortunately can't make it today. She was due to be, and on Friday she had her back surgery pulled forward by a couple of days, which overlapped with this. So she sends her profuse apologies, but she has recorded a little video, and she's asked me to do her introduction, which I'm sure I won't do her justice. But she's asked me just to introduce kind of the context between Hello Lamppost and RUH Bath first of all, and for us, really the platform remains the same, but it was interesting again in a completely different context and environment to understand, you know, what are the priorities for the audience at that place, at that hospital, and what are the priorities for the trust and the hospital. And I still remember the first meeting with the hospital and Joe, where, you know, there was 100 different ideas as to how the platform could be used across the hospital, whether it be a virtual assistant or, you know, engaging people whilst they're at their beds in wards. And actually, what we settled on is what, as a starting point, is what Joe's going to talk about in her recorded video in a second, and that's all about helping to automate gathering patient feedback and giving people relevant information when they're in a waiting area or in a ward or dwelling, whether they be a patient or a visitor. So it's kind of that automated communication and feedback gathering, which she touches on in her presentation. And that starting point from Joe, in Joe's words, it was to encourage more patients to give the hospital and staff feedback, particularly around the friends and family tests. So saving time for hospital staff and nurses on helping either complete the full survey or gathering that kind of priority or mandated feedback in a different medium. And as Stephen touched on, that mechanism is about that low barrier to entry, humanistic, conversational format, all on kind of people's devices. So I won't steal the thunder too much, and hopefully this does play. Stephen, did that play for you out loud?
Oh, sorry, no, I didn't hear the audio. Hold on, try again.
Information officer at the RUH in.
That's it.
Thanks.
Hello, my name's Jo Miller. I'm the Chief Nursing Information Officer at the RUH in Bath. And I'm here this afternoon to talk to you about our journey and how we've used Hello Lamppost within the Royal United Hospital. This is a picture of myself and Reshmi, one of our senior sisters in the orthopaedic department here at the RUH. And this is a little bit about our journey and how we got Hello Lamppost into the hospital. So a few months prior to embarking on this journey, I was at a quality board meeting where we were talking about a platform to enable us to get real-time patient feedback and how we could do that. We then came across Hello Lamppost, and we thought that it was very different, quite something that we'd never tried before, and how could we use that within the hospital to help us get real-time patient feedback. We're very lucky here at the RUH because we have an innovation panel where we have innovation funding available for projects just like this, up to the sum of £20,000. So I pulled a project plan together and took it to the panel, where we were lucky to secure the funding to trial Hello Lamppost within 4 pilot areas across the organisation. We started with 2 areas. We decided that we'd do all outpatients because that just made it simpler, and all of the areas except for the urgent care centre have exactly the same questions. But we also wanted to see what was going on in our sort of urgent care centre stroke ED waiting room. So hence why we put it in there as well. I think one of the things that we need to be that we learnt at quite an early stage was having our departmental leads engaged. It's really important that you've got the right people on board with this, especially when you're starting something completely new. And Reshmi was one of those. She was really engaged. She told her team all about it. They had it up on their boards. It was at their team meetings. They were talking about it a lot before it came in. I got asked several times whether they were actually having a lamppost in the department, which made me giggle, but we didn't. But that's then led us on to further thinking, which I'll come along to in a moment, further in the presentation. So we decided to go with banners and posters, and we've got QR codes on our banners, and we've got QR codes on the arms of every chair. So we also had to get our patient experience team involved. Well, I say had to, we didn't have to, but we did, because we wanted to make sure that we were asking the right questions. When you're given something to ask a question, what questions do you want to ask your patients, service users? You can just go on and on and on. So we had a look at all our patient surveys, we had a look at complaints, we had a look at our PALs. We also spoke to the team in what they thought that they wanted to know about, what was important to them. At that time, we haven't, up till now, we haven't actually involved patients, but we have talked to patients about how we improve things with some waiting room work that's been going on by the patient experience team. So our questions were all picked from what we wanted to know, but also what had come up in our surveys to make sure we'd made a difference. And they're all linked to our friends and family test. We have live dashboards, which is fantastic, because if there's an issue or if there's a complaint that is raised at the time, or staff just want to have a look at what the temperature is in their waiting rooms, they can log on to the live dashboard and they can see what people's feelings are at that time, looking at comments and also looking at sort of the live data, just to give them a quick sense check of what's happening. We get monthly reports written by Hello Lamppost, and we do a thing called Improving Together here at the RUH, and we've worked very closely with Grace from Hello Lamppost and our lead for Improving Together to ensure that our monthly reports are all done in the same format, which makes it easier for our staff to read, and it's a format they're used to. Those reports go to our quality board on a monthly basis as part of our patient experience report, and they also go to individual departments performance review meetings, where we have a lot of actions on those, as you said we did. What it has done is it's increased our patient feedback dramatically. I remember Reshmi telling me that it's gone from like 2% to 70%. She said she's getting a lot more feedback from patients, relatives, carers, and it allows them to act on changes, and it generates loads of ideas, and it's a fantastic talking point. Sorry, so the impact for the hospital, as I said, is we've had real-time patient feedback. We can see what there is, what there isn't. We've had increased patient feedback, as I said. We're doing a lot of work on You Said We Did. It saves on cost times. We've worked this out, sort of band 2, band 3, looking at giving out FFT cards, collating them, inputting them into a computer. So there's a number of hours saved by doing this electronically. It allows for improvements to be monitored through our performance review meetings, which I've just mentioned, and also it links automatically through to our friends and family tests. And staff now are asking to have Hello Lamppost in their areas. I've presented this to a number of meetings, matrons meetings, senior sisters meetings, outpatient meetings, and I had an email the other day from somebody who'd walked past the poster in audiology who was from dermatology and wanted to know when she was having her Hello Lamppost put up in her department. So we get lots of responses. I'll let you read these. I won't read you those, but you know, some of these things have allowed us to improve a better communication with our patients about waiting times. We've allowed, you know, that's been taken forward as an action. Vending machines, that's something we're looking at with our supplier just to see if we can improve that in any way. Patients are in our waiting rooms for a long time, especially in our urgent care centre, which is where these are from. The screen on the right hand side will show you the responses. It's the live dashboard and the keywords that are coming up there. So that's really nice. We've had some lovely feedback about individual staff members, as well as some areas where patients are concerned about and we could do something more about it. It is useful to read, and they are all incorporated in our reports, and you can drill down to each area. So our results so far. So this is part of how our report looks. So this is our results for orthopaedic outpatients on the left-hand side, and you can see that the themes and sort of 58% of our users said things were good, which is a 5, and 5.1% of our users said it perhaps could be some areas of improvement. We do ask similar questions about finding the department, was conversations with receptionist staff helpful or not, and provide information sort of around the waiting room, and were they clean, and were you given the right written information, and was it easy to understand. This was taken off a couple of weeks ago, so we've had more users. This is our total amount of messages we've had and total amount of users, and we've been piloting in those areas since the middle of June. As you can see, ignoring November's data, this was taken before the end of the month, but as you can see from the graph at the bottom, in October we'd actually improved on feedback month on month, and the day for us, which is really bizarre, is a Tuesday, where we get the most interactions with Hello Lamppost. So what's the future for us at here at the RUH? So we're at the moment in the process of seeking funding to expand across all inpatient and outpatient areas. We would like to use Hello Lamppost in our car parks. Car parking comes up as one of our sort of top things that's included in complaints and our PALS query contacts. We're also looking at estates where we can have a QR code in a ward area or a department area. Staff scan that code, and they know that then they have an equipment within that area. They just tick that box. So it might be that your bedpan masher's not working. They would go scan the QR code, click on the bedpan masher, and then would automatically go through to our estates department, who would have a triaging system the other end, which would save telephone calls and all sorts of emails and everything else flying backwards and forwards. And we're also looking at assistance around the hospital, so not a true wayfinding process, but if you're here, what's near to you, where's the restaurant, that type of thing. We're designing more design thinking opportunities. So we've got our posters, we've got our banners, we've got our stickers on the chair, and they're really bright, they're really colourful, and they really do grab people's attentions. But when you're lying in a hospital bed, you possibly couldn't get up to go and scan something. So we're looking at having something like, hello, I'm Terry the table, I've been in this ward for so many years, how long have you been here, how's your stay? And so we're having a true interactive discussion with that particular object. It needs to be visible and accessible. I was sat in orthopaedic outpatients the other day, and I was in a chair that, because it was busy in a transport area waiting for transport, even though I wasn't waiting for transport, and I wouldn't have been able to access the poster easily. It'd been moved back, so we just need to make sure it's really visible and accessible. We are looking at putting the QR code on all our clinic and discharge letters, because one of the feedback we've had from one patient is, I don't want to fill in anything until I get home, till I've had the full experience of my visit to the hospital, which was really good feedback. So that will enable patients, carers, relatives to feed in when they get home. And I want to involve our patients more. I want to get their experience on it. So I want to use the patient user group and get them involved in where we go next with this. It's such an exciting thing, and I have to say, I sit here now talking to you about this, and I'm thinking, what else could we use it for? What else could we use it for? The possibilities are endless. Thank you very much for listening to me today, and I'm really sorry I can't be there with you. But any questions, then the team at Hello Lamppost have got my email, and I should be back at work mid-January. I'd be more than happy to pick up any questions then that can't be answered today or for further conversations. Thank you very much. Bye-bye.
Yeah, huge thanks to Joe there for putting in the effort on recording that at very short notice. I do just want to add one point before we do go on to questions, just off the back of Joe's presentation. Actually, we were super impressed as a team that the hospital and the trust aren't just thinking about innovation and technology for innovation's sake. Actually, they're approaching it from a problem perspective, and that was again one of the first kind of sessions we had with them. Was yes, they were interested in what our platform could do, and they'd seen other applications of our platform, but actually they approached it very much from a what is top of the agenda for the trust and the hospital, and what problems are there, and we very much approached it from a perspective of well if our platform is not a fit for those problems, then you shouldn't go ahead with using technology that's just going to be for technology's sake. So yeah, really innovative team at the RUH, and Joe and David, CIO there, are particularly impressive. I know we're running a bit behind on time, so I'm going to switch over to questions. If anyone does have any, please feel free to put them in the chat. I would assume they'll probably be mostly for Stephen, but if there are any for Joe, obviously still pop them in the chat, and we can send them on and follow them up. Stephen, I don't know if you can see them in the chat. Otherwise, I can pick a few out. But is there any you to start with?
Yeah. So I've gone back. Jenny had asked about other methods, and I've answered in the chat. But I think it's I think your point about problem solving is really important. When I first encountered Hello Lamppost by seeing it being used on other things, nothing to do with suicide prevention. So when we were discussing it as a team, it was very much what problems do we have that we're trying to solve, and is it possible? And I think as Tiernan said at the start, I don't think Hello Lamppost had really considered the kind of areas that we were looking to solve. I'm really happy to have a sort of more in-depth conversation with anybody who wants to know about anything to do with the campaign. In terms of Victoria's question about information governance, it is anonymous. We don't collect, the service itself doesn't ask for a person's name or anything like that. Obviously, the mobile number that is used, but we don't share that as the mobile number. So each interaction comes into us with an individual unique identity number. It's not linked to that person, and that's obviously really important. And we obviously took legal advice internally about all of these aspects, as you would expect, in terms of the data that was, or any data that was being collected. In terms of Jenny's next question, what advice would you give to organisations considering using a digital engagement tool to support and engage their community? I think a lot of the groundwork for a lot of these things is done in advance. So I think the fact that we were already campaigning on a lot of these issues was really important. That campaign was really recognisable. It was on billboards, it was on bus backs, it was on a whole range of media. I think part of my role is to do with community partnerships, so that's much more direct face-to-face conversations with community groups, with voluntary organisations, and in general terms, we try to build really strong relationships at that level, so that when a campaign does start, or when a Feel Well NL plate appears on a bench, that people are already aware of that within the local community, and particularly those who are, I suppose, more direct. I was going to say influencers there, but that's taken on a whole different meaning these days. But who are very influential in terms of those interactions. So I would strongly advise anybody trying to roll out any kind of engagement tool to really not just consider it as a one and done thing. These are long for me. The suicide prevention campaign is a really long-term campaign that we talk a lot about with communities directly. How has deployment benefited the local community? Well, we know that suicide has a very extreme impact on communities, particularly where you have cluster concern. So we had between 2016 and 2017, there were a number of young people who completed suicide in a very, very localized area. And we know that the impact that has, not just in terms of grief and loss and all of those things, but also clusters, particularly amongst young people, are very, very challenging because the details of some of that, and people locally are well aware of the details, and it can encourage others to attempt suicide. In terms of the overall wider campaign, it's absolutely benefited the community. In terms of those locations of concern, that is potentially 22 people who were going to complete suicide who didn't. And that has a massive impact, not just on the local community, but also, for example, in the case of the Strathclyde Park, the staff at the park, the people who are the first responders, the police. It's quite hard to measure these impacts in a very tangible way. But when you talk to families of people who have completed suicide, the devastation and that sense of loss is because in a lot of ways, people blame themselves when someone close to them completes suicide, and in a way that they might not with other types of death. It has a huge benefit as far as we're concerned. And it's not just about suicide. Ultimately, it's about mental well-being in general terms. So, what we call the good route, if you like, in terms of the deployment of the Halo lamppost technology, is about, if somebody says they're feeling fine, it's about, well, what can we suggest to you that might improve further your mental well-being? So is that going for a walk? Is that going to a museum? Is that visiting a leisure centre? Any of these things are hugely important.
Yeah, great. Thanks, Stephen. I think I've got an additional question, which is I suppose a bit broader. You obviously cover a really broad range of topics and a broad range of areas and audiences. I'm just interested that what would you say your biggest challenge when trying to communicate with your audience as a council is?
Sorry, I couldn't get off mute there. Our biggest challenge is what we would call, or what comms professionals would call, hard to reach audiences. So North Lanarkshire has a lot of areas of multiple deprivation, and engagement with an authority, in inverted commas, is often quite difficult for a lot of those people. So how do we present something that is appropriate in terms of tone, that isn't hectoring, that isn't, an authority figure talking down to people, is really, really, really difficult. We're seeing this just now. We've just started another campaign around about cost of living, as a lot of people on this call will be aware that that is probably the single biggest issue for people. And doing that in a way that is non-stigmatizing is quite challenging. And the very bright people I have who work with me, who come up with these messages, test those messages and see what works and what doesn't. Ultimately, a campaign that isn't evaluated in some way isn't a campaign at all. So, we constantly refine and look at the data and look at the statistics and say, and actually ask people, what did you think of this? But that's, I would say, our biggest challenge is, particularly in an area of quite significant deprivation in parts. I would say that's our biggest challenge, is talking to people in an engaging way.
Right, and then I think we've got one time for one more question, if that's all right, Stephen. Which again is one that just popped into mind. And when you're thinking about those challenges, and your way of working at the council in general, I suppose, off the back of what we've experienced working with you guys, but how do you approach as a team and as a culture that challenge of doing tech for tech's sake? There's clearly so many suppliers out there, and so many fast moving, evolving technologies, you know, how do you guys at the council and your team in particular approach challenges and you know, treading that balance between innovating and tech for tech's sake?
Yeah, when I started doing comms for a living, which wasn't yesterday, a lot of people would say, "Oh, we need a poster." All right. Okay. Well, what do you need a poster for? No, we just need a poster. And do you know what would be even better is we get some kids to design the poster. And that used to be the conversation. And then that round about 2010, that kind of evolved into, we need a Twitter page, right? We need a Twitter profile. Why do you need a Twitter profile? Oh, we just do. You know, it's important that we're in that space. So there's always been this demand for you know, for use of technology from the wider organisation. I think the job of the comms person is to really get behind what you're trying to solve. What is it you're trying to do? Why do we do this? We don't, we report on our campaigns. We're held accountable for those campaigns. In other words, what difference did that campaign make? Whether that's a suicide prevention campaign or a cost of living campaign or getting somebody to put their bin out in the right day campaign. What difference did that make? And the way that we always approach it is to say, you know, what is the most appropriate thing to use here to get that, you know, to meet that objective? And for this campaign, one of the bits that was missing for us was that I described it in the chat in answer to Jenny, that moment of danger. You know, we can't have somebody there in every place all of the time. So how, you know, when that moment of crisis for somebody is there, what is the thing that we can do? And for us, the Halo lamppost technology was that thing. But that might be different for something else. So it's about knowing your objective, knowing your audience, having a clearly defined strategy, and then using the right tools to implement that strategy.
Right, and I think we certainly saw it with both your example, but in particular the RUH is also not rushing into, you know, that to use your analogy, we need a poster, not rushing into let's just throw something up there because we think it might be right, but tying it to what are the challenges, the problems. Conscious that apologies, we've run over a little bit, but for everyone still on the call and everyone viewing this recording, if you do have any questions, please feel free to send them through to the inbox on the screen, and we can follow up with Stephen and Joe from the RUH, and I'm sure they'll be happy to answer any further questions. I do just want to take a moment just to thank Stephen and obviously Joe, who couldn't be here, for joining us today. You know, we're enormously thankful for having you on, because you are incredibly forward thinking in kind of what you're doing, and the work that you're doing is incredibly impactful. So thanks for taking the time out of your day to kind of share your experiences and insight in the space that you guys are working in. We will be circulating a recording of this in a follow-up email to everyone who's signed up, and thanks for those who've attended today as well. You know, extremely appreciative for everyone who's taking time out of their day. But yeah, that's the end of the webinar. So thank you everyone for coming along, and I hope you have enjoyed the webinar. There's more to come in our kind of series of webinars, but yeah, apart from that, just leaves me to say hope you have a good rest of the day, and thanks very much.